friends, this is Dr. Deepak Agrawal. I am a professor of neurosurgery at the All India Institute of Medical Sciences, New Delhi. Today we are talking about back pain, specifically lower back pain. There are many types of back pain, including pain in the neck, backache, lower backache, and backache with radiation to limbs such as legs and hands. So as I said earlier, today's topic will be on lower back pain. You will be surprised to know that more than 10% of the population of the world suffers from low back. That's almost 1/10 of 8 billion people. So you're not alone if you're having low backache. What do you mean by low backache or the classification or types of low back? It can be a simple ache which is limited to the back, or it could be radiating down your legs, or it could be radiating along the ribs anteriorly towards the stomach. So these are the three main types of backache, of which the most common is when there is no radiation, it is limited to the back, increases on movement and gets relieved when you lie down. So we describe back pain depending on its onset. It could be sudden onset. Suppose you bent down to pick up something, or you picked up a heavy bucket and suddenly you got back pain excruciatingly severe, which then slowly resolved on bed rest, or it could not resolve also over few days or weeks. Then there is the back pain which gradually increases over time and becomes so severe that you have to take help from a doctor. Now, what are the causes of back pain? Most of the causes are because of the spine itself, because as we know, the spine consists of 33 vertebrae, the cervical, thoracic, lumbar vertebra, as well as the sacral vertebra. Now the lumbosacral vertebrae are the ones which are usually the cause of low backache, and besides these vertebrae which may having to constantly move upon each other, there is a disc or a washer between each vertebra. Sometimes the washers wear out over time and they slip either in front or back, which leads to compression on the nerve roots, and this is the cause of radiation or pain along the nerves. So degenerative spinal disease is one of the most common causes of low backache, and this occurs as a person ages. So if you are more than 50 years old, you are a little fat, you are more than likely to have backache. Also, backache is common in individuals who have a bad posture. So while you're sitting in the chair, or you are sitting in a sofa, or anywhere in the house and you don't have a proper posture, it may lead to backache. Thirdly, backache can be because of tumors or vascular pathologies like a bunch of vessels which may be there, but these are very rare. Besides this, what we don't know usually is that backache may be caused by other pathologies. Suppose arthritis is there, like rheumatoid arthritis, it may lead to backache because the joints are here also. Or there are other autoimmune or connective tissue diseases. These also cause inflammatory changes and flare up in the ligaments, which we commonly see as sacroiliitis, and this may also lead to backache. The treatment for all of these are dependent on the pathology. So if it is because of the spine or the disc, then the pathology is different and obviously treatment is directed towards that. If it is because of arthritis or another autoimmune disorder, then the treatment will be directed towards that. So how do you know what is the cause of your backache? First, obviously, you have to get assessed by a doctor, a neurosurgeon or an orthopedic surgeon, and after evaluation, the most common test advised is an MRI of the lumbosacral spine, that is the lower back. Now, one thing to understand is we are not treating the MRI. Patients usually come back to me saying that, doctor, there is so much written on the MRI report, there is so much compression and things going on, we are really worried, what should we do? So do not get alarmed by whatever is written in the report. The clinician actually assesses the actual film and sees if there is actual compression or not, because it's the radiologist's job to document even minute compressions which are normal for the age and your BMI. So if we as a clinician say that there is no compression, then we have to search for other causes of backache, which I just enumerated. Could be arthritis or some other disorders like even gout. Once we have ruled out any significant compression on MRI, then we can refer you to a rheumatologist or a metabolic disease specialist to further evaluate you. However, in case the MRI shows significant compression by a disc or some other degenerative disorder, the first line of management is conservative. By conservative, I mean trying bed rest, physiotherapy, weight loss and other restrictions. I know a lot of you come back saying that doctor, we have been shown somewhere and the MRI shows something and the doctor has said immediate surgery. Surgery is never required urgently except in a very few select cases. And what are those select cases? In case your feet stop moving, so you cannot move your feet, you have urinary retention, or you have further symptoms which cause numbness or weakness in the limbs. These are the only indications for an emergency surgery. Other than that, all trials have shown that after 2 years, be it surgery or be it conservative management, the outcome is the same. The only reason we advise surgery is that there is so much pain that you cannot go on with your day-to-day activities despite trying out all conservative methods including physiotherapy and rest. However, if you can manage, conservative management is the best. In that, we advise you to first do physiotherapy, which includes ultrasound waves, includes traction, includes other exercises to strengthen your muscles of the back and the legs. Also, we advise that you sleep on a hard bed. A foam bed is never good because it leads to a different kind of a posture which is not good for the spine. Besides this, we may advise you certain medications like painkillers and vitamins like B complex to help with the improvement in the nerve as well as the pain, because we have to stop the vicious cycle of pain and increased muscle spasm leading to further pain. Also, in the end, I would like to say that almost 90% of all back pain is completely treatable provided doctor's advice is followed properly and lifestyle changes are done. Thank you so much.